And now for the disclaimer. As we transition to the next portion of this informative webinar, I need to share this disclaimer. The views and opinions expressed by the guest panelists and or presenters do not reflect the views or opinions of the Delta Research and Educational Foundation, Draft Research Matters for All of Us, the NIH All of Us Research Program, or any of these organizations' affiliates. Tonight, we are wrapping up our Let's Talk Women's Health series with a discussion on mental wellness and motherhood. Natasha Dalberist is a wife, mom of three, and psychotherapist born and raised in South Florida. Natasha's journey into the mental health field began in 2009 after receiving her BA in behavioral health care from University of South Florida and a MS in marriage and family therapy from Nova Southeastern University. She has 10 years of experience as a psychotherapist working in various settings. She is the owner of Dalberist Counseling and Wellness, where she specializes in providing services to women experiencing anxiety, trauma, stress, pregnancy loss, and pregnancy and postpartum concerns. Natasha's passion for mental wellness. Natasha's passion for maternal mental health stems from her own experiences with pregnancy loss and birth trauma. She takes joy in helping women heal, prioritize themselves, and have the quality of life they desire. She also enjoys providing education and speaking on different platforms on topics surrounding mental wellness, motherhood, and stress management. In her downtime, she enjoys quick getaways, dancing, and spending time with her loved ones. Please join us in welcoming Natasha Dalberist.
Thank you so much, Lakeisha, for that amazing intro. I am sharing my screen. Okay, here we go. Good evening again, everyone. Thank you so much for having me. Thank you for this opportunity. I could honestly talk about this for 2 hours if you let me, but I know we don't have that time. So I'm gonna keep it to I think the 20 minutes or so that I've been given to speak. So of course, as Lakeisha mentioned, we're going to be talking about mental wellness and motherhood. It's such a broad topic because there's so many things that I could say and I could talk about when it comes to maternal mental health. But I wanted to just keep it to the early stages of maternal mental health, meaning pregnancy, postpartum. So up to 1 year or 2 years of being a postpartum mom. But I think some of the information, well, not some, all of the information that I'm going to provide this evening is helpful for everyone, right? So whether or not you are a parent, if you're not a parent, you know a parent, right? And even if you're not a parent and you probably don't know too many parents, there's still so many things that you can do to be helpful to someone who is thinking of having a child, who already has a child, or who has even experienced some level of loss, pregnancy. Will gain some information and insight from this presentation. If anyone wants me to send them the PowerPoint presentation, I can email that to you sometime tomorrow. So if you just send me an email or put your information in the chat box, I can definitely have that sent over to you. Okay, so why does maternal mental health matter? There are so many reasons. I can probably think of 50, right? But for this slide, I put what I believe are maybe like the top 5. And so the reasons are that anxiety and or depression affects 1 in 5 perinatal women, right? And in some areas, it's actually 1 in 3. So high risk areas, low income areas, which usually typically include women of color, Black women, right? So in a lot of these areas, it's 1 in 3 as opposed to 1 in 5. Now, this statistic is from last year. Actually, this statistic is from almost 2 years ago. And so in my practice, working with this specific population, I have seen an increase since the pandemic, right? And so I think that the numbers are even higher, but for the sake of the most recent research, it's 1 in 5, and in high risk populations, it's 1 in 3. So PMADS, which stands for perinatal mood and anxiety disorders, which I'll kind of talk more in depth about in the next slide. That is the number one complication in pregnancy and childbirth, right? And so, so many women, especially women who look like me, so Black women and women of color, suffer in silence because a lot of these things are still taboo. We're talking more about it. I know personally for myself and also other therapists who specialize in this area. We're speaking more on platforms. We're talking on podcasts. We're writing books, making workbooks. We're connecting with doulas and OBGYNs and pediatricians, and really doing as much as we possibly can to break that stigma. So that it's not the number one complication in pregnancy and childbirth, but for now, that is what it has been for many years. Black women are 3 to 5 times more likely to die during childbirth than white women. And I know that this is probably not a new statistic. Many of you have probably heard this. And the unfortunate reality is that this is still the case even in 2022, right? So this was a statistic many years ago, right? And for some of us, we could say, okay, well, that probably makes sense because of science and because of, so many different reasons. But in 2022, this is still an issue that we are struggling with, that we're battling with. And I can't tell you guys how many phone calls I get to my office regarding near-death experiences, right? And so just that the trauma that comes with that and the distrust in the healthcare system. So there's so much that needs to be done. But platforms like this and being able to present and talk about this topic helps, right? It helps to reduce that stigma. 50,000 women suffer life-threatening complications. Again, I think the number is higher, but based on the last statistic, the last research, 50,000 women suffer life-threatening complications during their labor and delivery process. Suicide is a leading cause of death in the first year postpartum. It's disheartening to think that suicide is a leading cause of death in the first year postpartum, because there's so many things that can be done to help women and treat women. And I say women, but I'm also speaking to men as well, because men suffer 1 in 10 and women suffer 1 in 5, right? So there's a 50% chance that if a girlfriend or a wife or, a partner is suffering from a perinatal mood and anxiety disorder, that her partner may experience that as well. So a quick overview of the symptoms of perinatal mood and anxiety disorder. So when we speak of mood disorders, we're speaking to perinatal depression, which oftentimes we hear of postpartum depression, right? I think that's a common term that we hear often. We're also speaking to bipolar disorder. So some of the symptoms that we look for in women who may be experiencing postpartum depression are social withdrawal, feelings of anger, sadness, lots of irritability, lots of guilt, changing, a major change in their sleep, a major change in their appetite, major change in their just day-to-day like interests, things that they once used to enjoy. And so, of course, we know with new moms, the opportunity to just jump back into those things aren't, really available, but the interest should still kind of be there, right? And lots of feelings of hopelessness. So the way that we screen for perinatal depression or postpartum depression is if a mom reaches out to us and says that she is 2 weeks postpartum or even a few days postpartum, we kind of look at that as being normal, right? And so the first 2 to 3 weeks, we call that baby blues. So the symptoms that I just mentioned, those are normal, right? Because, you've gone through just a major change in your body, hormonal changes. And so the first couple of weeks or so is normal and also to be expected that women will experience these symptoms. Now, after 3 weeks, if these are still the symptoms that the mom is saying that she is experiencing, then we go into looking into other measures. So we do screenings. Of course, we recommend psychotherapy and depending on the severity of the depression, sometimes medication. Bipolar disorder, some of the symptoms would include intense mood swings. Mania, when we speak of mania, we mean like just very high energy, feelings of like euphoria, like you're on cloud nine, like nothing bad can happen. And then, of course, the depression is very low. And so these symptoms may consist of just extreme sadness and despair and lots of like irritability and restlessness as well. And so, again, there are specific screenings that we do to measure where our mom is in terms of bipolar disorder. As far as anxiety disorders, we have PPTSD, and that stands for postpartum. That stands for postpartum stress, traumatic stress disorder. And so that is usually as a result of birth trauma. And so typically women who are experiencing this, they'll say that they had either a very traumatic labor and delivery process, or they had a very traumatic time just at the hospital with the nursing staff and not feeling like their voice was heard. Or for some women who want to maybe have a natural birth, and if they had to have an emergency C-section, they may be experiencing and exhibiting some of these symptoms. Lots of flashbacks, maybe nightmares, very triggered if they're driving, if they have to drive past the hospital that they gave birth at, right? And so some of those things are things that we work through in therapy. OCD, some of these symptoms include persistent thoughts, intrusive thoughts. When we say intrusive, we're basically meaning scary thoughts, right? So if I'm taking the baby a bath, I may have thoughts of drowning my baby in the tub, right? And so some of these thoughts are very normal. And so this is one of the things that kind of we talk about in therapy, is that psychoeducation piece, that over 80% of women or new moms experience intrusive thoughts. And so these are very normal. However, with OCD, it's like persistent, right? And so it's not just like a once, it just randomly popping up in your mind because you're tired and because of the hormonal changes. It's like a persistent thought that's continuously happening. And so if that is happening, that's not normal, right? Those intrusive thoughts are not normal. And so these are things that we have to work through in therapy. Panic disorder, of course, lots of nerves, right? Reoccurring panic attacks. And with panic attacks, I know a lot of times we kind of get confused with panic attacks and anxiety attacks. Panic attacks give you no warning. So when you think of a panic attack, think of like zero warning. You just started having shortness of breath and chest pains out of nowhere. Anxiety attacks typically are as a result of being triggered by something, right? So someone said something, someone did something, and so you're triggered by that, and then you have an anxiety attack. Anxiety disorders, of course, also includes the anxiety, right? So extreme worries and fears. And it also includes psychosis, which is very, very rare for a woman to experience psychosis. And oftentimes, I'm sure many of us have heard stories or seen stories on the news regarding a mom who harmed her baby, killed her baby, or attempted to do that to herself. That is psychosis. And it's usually looked at as postpartum depression, but that's something that I feel everyone needs to be aware of, that is psychosis, that is not postpartum depression. And the reason why I say that is because when we associate suicidal thoughts and plan with postpartum depression, then you will less likely have women who say, I may be experiencing postpartum depression, because oftentimes these women love their babies, right? They love their babies. They don't want to harm their babies, but for whatever reason, they are experiencing these different symptoms. And so just knowing the difference between psychosis versus perinatal or postpartum depression, I think is very important for all all of us to know. So one of the questions I always get is, why does this happen? Why is it that so many women are experiencing postpartum depression, or, these mood disorders and these anxiety disorders? And there is no one reason, right? There's several and many different reasons. There are biopsychosocial factors, and the biological factors would include mental health history, right? So did you suffer from anxiety prior to being pregnant and giving birth to your baby? Hormonal changes, general health, right? What does your general health look like? Are you diabetic? Do you already have high blood pressure? Do you already have like these underlying conditions? Your reproductive history. Oftentimes, women will say, I've suffered 3 miscarriages before I got pregnant and had this baby. So those are very important to be aware of, because those may be factors that increase your overall mental wellness as a mom. Psychological factors, of course, your identity, of course, changes when you become a mom. What is your behavior like? What are your expectations of becoming a mom? Of course, social factors, right? What's happening in your environment? What traumas have you experienced as a child or even in your adult years? What is your relationship status like? Is that relationship healthy? And also, what are the resources that you are aware of that are helpful for you? And are you tapping into those resources? So, stigma surrounding mental health. There are different, of course, so many different stigmas surrounding mental health, right? Especially in the Black and Brown community. But 3 that I put here are label avoidance, right? And label avoidance is when a person chooses not to seek mental health treatment because of the stigma that's attached to it. So there's a label that if I seek mental health treatment, then something must be wrong with me. I may be crazy. I'm not a good mom. I'm not a good parent. Something must be wrong with me. There's that label there. And so the more we talk about mental health and the more we talk about the importance of it, of course, it helps to reduce that label and it helps to reduce that stigma. The social and public stigma, of course, refers to the negative stereotypes of different mental health disorders, right? And so sometimes even on social media, I'll see people joke around like, oh, she got bipolar or he had bipolar. And, we're all saying this in a very joking way, but all that does is increases the stigma, right? So if someone's joking about someone else having bipolar, whether or not it's true, if I truly have bipolar and I was diagnosed with it, I'm definitely not going to share that because you're making a mockery of it, right? And so we just have to be mindful of those, just language and some of the things that we say when we're speaking or we're talking about mental health. And there's also the self-stigma. And that is basically when we internalize the social stigma and the public stigma, right? So we internalize these things and we think to ourselves that if I am diagnosed with postpartum depression, that means that I am what my diagnosis is, right? And so this is something that I work with a lot with my clients, is getting them to understand that they are not their diagnosis. And so that is just a small piece of the puzzle. And most times than not, these diagnoses are always most times than not, they're treatable. So some of the barriers to seeking treatment are both psychological and also practical, right? And so psychological is being in denial, right? So if this isn't something that if mental health isn't something that I heard growing up, if my parents never talked about it, or if I don't have family and friends who are constantly talking about their mental health and their overall well-being, then 9 times than not, I'm probably am going to be in denial because this isn't something that I'm really privy to or really aware of, right? So being in denial is something that I notice, especially with my clients who are predominantly Black, that there is a lot of denial that happens before they reach out and call me. And by the time they call me, they're in crisis mode. So this isn't just being proactive, like, hey, I'm not really feeling myself. I'm not really feeling like this motherhood journey is what I expected it to be. Can we just kind of like have a few sessions so that I can make sure that I'm okay? That is being proactive. But most times than not, by the time I get a call, it's it's crisis mode. I've been feeling this way for 2 years. I have 3 kids, and I felt this way after the first child, but I didn't want to say anything because I thought that I could push through it. So there's all of that that's happening, right? Of course, negative past experiences. What were your past experiences like with a previous therapist or a previous psychiatrist or even a previous medical doctor, right? And so if your experiences have been negative, then of course you're less likely to continue reaching out for help. Fear of being labeled. So we talked about that in terms of like stigma, and that, I'm weak, right? I'm weak. I'm not strong. I saw my mom and I saw my grandma have 5 kids, cook, clean, and do all the things. What is wrong with me? I have 1 kid. What is my problem? And so that I hear that a lot. From my moms. Practical barriers to treatment is lack of support, right? And so learning what your resources are, learning about the resources that are out there, which many of them are free. So some may cost, but then there are other resources, which I'll get to at the end, that are completely free. And so allowing yourself to just try it. That's what I always say is there's no harm in trying it. So try it out and see if you like whatever resource that is that's available to you. The financial commitment, of course, some of these things do cost money. So there are some people who are uninsured. And so a self-pay in Florida averages between 100 to 125, sometimes even 150 for individual therapy. And so just thinking of that number alone is like, okay, no, I'll figure it out on my own, right? And so these are things that we have to just kind of talk more about, because even if you cannot afford a private pay therapist, there are many therapists who accept insurance, and there are also nonprofit organizations that specialize in working with moms that are free. And so I'll also speak to that when at the end. Limited access to healthcare providers, especially providers of color. For therapists, we make up about 4% of the mental health community, right? And so 4% is not a lot at all. It's not a lot at all. I know from my practice is almost full. I'm at the point where I probably won't be able to accept too many people within the next couple of weeks, right? And I'm hearing that a lot of my Black colleagues are having the same issue as well. And so, and it's because there's less of us than there are, our white colleagues. So ways to fight the mental health stigma, doing what we're doing right now, right? So talking openly about mental health, educating ourselves, educating others as much as we can, reading, being conscious of our language, like I mentioned earlier, right? So things that we may say just, without the intent of hurting anyone's feelings, but it could do that. It could cause a lot of damage, right? And so just being mindful of our language, showing compassion to ourselves and to others, that again, if you are struggling, it doesn't define who you are as a person, and it doesn't make you a bad person at all. It doesn't make you a bad mom. And so reaching out for help takes great strength, and it certainly takes a great level of vulnerability. Choosing empowerment over shame. Right. I find that with my clients, they feel empowered literally within the first few sessions. They feel empowered. They feel like, I can speak up for myself, and that helps a lot, right? It helps a lot because then it also helps them not feel like they're alone when they realize, like, wow, like I'm not the only one that's struggling as a new mom or just as a mom in general. And being honest about treatment. It's not a one size fits all. So there may be certain things that you may not like, or certain things that you may feel you need from your provider, your mental health provider, or even your medical provider, right? So advocating and speaking up for yourself, writing down questions if you feel like you get nervous during your sessions or during your appointments, maybe writing them down beforehand so that when you do go in there, you can ask some questions or make certain comments that you feel may be helpful for you in your treatment process. So a couple of the screenings that we do for moms who are experiencing postpartum depression is the Edinburgh screening. And we kind of, it's the acronym for it is EPDS. So that screening, as well as the PHQ-9 screenings. A lot of doctors' offices implement this as well. I know some doulas who also give these screenings to their clients as well. And based on the score, then they'll refer them to therapists who specialize in maternal mental health, such as myself. So these are screenings that are being done at hospitals, some hospitals that are being done at doctors' at OBGYN offices. I do them in my practice. Doulas are doing them as well. And then there's the GAD-7 screening, which screens for anxiety. So the path to wellness, what are some things that we can do to help ourselves, right? To help other women, even if this doesn't necessarily apply to us. One of the big things that has been found is that fish oil helps with postpartum depression rates. So the lower your DHA is, that equals higher postpartum, the risk of higher postpartum depression rates. So over-the-counter fish oil, of course, I'm not a medical doctor, so this is always something that I tell my clients to speak to their medical providers about. But generally speaking, fish oil is helpful. Rest, of course, sleeping as much as you can. Of course, that doesn't happen early on during pregnancy and postpartum, and even in motherhood in general. You may not be getting a lot of sleep, but just trying to be mindful and intentional about taking breaks and getting sleep, prioritizing yourself. So self-care activities, engaging in some of the things that you find interest in, your social support. 9 times out of 10, I'm recommending a support group for my moms, right? So that they can be surrounded by women who get it, who understand, and so that they are not constantly kind of, being lost in their own thoughts. Relaxation techniques. I teach my clients lots and lots of diaphragmatic breathing. What it does is, especially if you are a person who worries a lot and gets anxious easily, it calms your nervous system down, and it allows you to just be able to process and think about what it is that's happening in the moment. Yoga, and of course, there's many other relaxation techniques. Physical activity, of course, walking. If you're not a big exercise person, I always say, go and walk for 15 to 20 minutes, right? What that does is it produces these hormones in our bodies called endorphins, and it just makes us feel good, right? Even if it's just temporarily, it gives us a break from thinking about stress and all the overwhelming thoughts. Psychotherapy, of course, nutrition, what we're eating, how often we're eating. Are we skipping tons of meals? Are we eating just one meal a day? What does that look like? And of course, medication in cases where our clients need them. So what is something that we all can do, right? This out of all the slides, I think this is probably one of the most important slides. Like, how do we talk to moms, right? And that's across the board, whether it's a pregnant mom, a postpartum mom, or a mom with a teenager, right? These are some of the questions that can be tweaked a little bit, but some of the questions that we can ask our moms. So, how are you feeling about being a mom? Are you able to sleep at night when baby is sleeping? How's your appetite? Do you have an appetite? How are you coping with the additional stress of the baby? Have you been feeling sad? Have you been feeling down? When we ask these specific questions, it helps the mom feel like, okay, maybe I can open up to this individual, right? Because oftentimes what's being asked is, oh, how are you doing? And the first thing that comes out of our mouths is, oh, I'm fine. I'm okay. I have this thing with my new moms where I say, when I ask them how they're feeling at the beginning of the session, I also preface that by saying, you are not allowed to say fine, good, or okay. So then they sit there and they're like, oh man, that's all the answers that I had in my mind, right? So it forces them to really think about how they're truly feeling. And so I think these are some great questions to ask a new mom. So here are some resources that I have here. The maternal mental wellness plan is kind of like a checklist that asks a bunch of questions for a new mom, right? It allows her to be able to check in with herself. It's a great conversation tool for her to have with her partner. Postpartum Support International. This is a very important website. This is actually the website. This is actually the organization where I received my maternal mental health training and certification. You can go on there and find therapists who specialize in maternal mental health. You can get free support groups across the board. There's some for NICU moms, there's some for Black moms, there's some for Asian moms, there's some for moms who have experienced loss. And so I think this is just a very important resource. And so if you don't look at any other resource on here, please take this one. One book that I recommend to many of my clients is called Good Moms Have Scary Thoughts. And so it really goes in depth with intrusive thoughts and what that looks like, and just kind of normalizing that, because having scary thoughts is just something that as new moms you will have, right? And so it's a great book. Healthy Start Coalition, as well as Healthy Mothers, Healthy Babies are Sorry, I was muted. So Healthy Start Coalition and Healthy Mothers, Healthy Babies are great resources for nonprofit organizations that provide in-home visitation, therapy, support groups, all of those different things. And there's a couple other websites on here as well. And I think that is the last slide. Oh, this is my contact information if anyone wants to take that down. And then lastly, my little kids, my 3 kids, and the reason why I put this slide is because if it weren't for my journey on just my maternal mental health journey, I wouldn't have the passion that I do to work with moms. And so I would definitely be remiss if I didn't show this picture of just my kids, because it always reminds me of my own personal journey and why I do what I do. Thank you. Are there any questions for me?
Thank you. I know there were some questions in the chat. I think either Alicia or is Janine on as well?
I am on and I can read the questions. I know Dr. Anderson answered one of them for us, so let me just scroll back up. I think Alicia may have had a question as well. Let me look.
One of the questions that was in the chat is the PMAD a part of the neonatal screening of pregnant moms?
The neonatal screening of pregnant moms, are you referring to the Edinburgh screening? If
Dr.
so,
Anderson?
I'm sorry.
Go ahead.
If so, the Edinburgh screening only screens for depression, postpartum depression. So it would only screen for that, but there are other screenings that can be done for any of the other perinatal mood and anxiety disorders.
Okay. Thank you. We have another question too. And the question is, once symptoms such as these begin to manifest, what range of time does it take to see true, consistent progress?
It's hard to say because it depends on the person. I think it depends on if they've already suffered from a mental health disorder. It depends on their environmental factors. It depends on so many different factors. So it's hard to give like a true timeline. What I will say is that oftentimes my clients work with me for a minimum of 3 months. So I would say about 3 months minimum. And then I have clients that I've been seeing for over a year. But what happens is over time, we transition to less frequent sessions. And so I'll start off seeing clients once a week or once every 2 weeks. And then eventually we'll transition to bi-weekly or every 3 weeks. And then I have clients who see me once a month as maintenance, because therapy is self-care, right? And so for some people, it's not about like, oh my gosh, like something has to be wrong. It's for them. For some people, want that 1 hour of peace that they're able to get, and allowing themselves to be vulnerable with, whatever is happening in their lives. So about 3 months or so, I would say, or longer. But again, it's hard to say. it's individually based.
Okay, thank you. And a lot of people obviously said it was a great presentation, and they would like for you to put back up your contact slide again if you can.
Okay.
May I? This is Tadra, Dr. Anderson. Great presentation. I agree. I just wanted to chime in on that last question. I would agree it's very individual because we don't all, just like our symptoms, we may not all have the same symptoms. It's individual
Exactly.
treatment, individualized treatment. So it should be really like precision medicine, right? Which is what we're
Mhm.
advocating for. And so not everybody responds the same way. And so for someone who might need just psychotherapy, they might respond differently or time-wise differently than say someone who has to escalate to medication. I'm not advocating for medication first, but as you heard during the presentation, some people do need it. And it can take a while for that to really kick in and stabilize someone where you then consider taking them off of that. And you have to be monitored during that entire time. So it does definitely vary. And the other thing I would just add that I did put in the chat, from a screening standpoint. So for postpartum screenings, you heard the speaker speak very eloquently about that. There are screenings that are recommended by the American College of OBGYN, ACOG, as well as the American Academy of Pediatric Societies for screenings during pregnancy, which your OBGYN should be doing, but also during the labor and delivery process to just see if you have risk factors that put you at higher risk at the beginning of the admission, which usually is done in conjunction with the nurse. And then your physician should also be engaged in asking certain questions prior to discharge, again, to see if there's any change during that time where hormone levels have significantly dropped, and also to give you warning signs before going home. So those are some things that physicians or your nurse practitioner, midwife, your team should be doing prior to you leaving the hospital. So I just wanted to add those couple of points from a clinical side. So thank you for letting me add. Awesome presentation.
Thank you.
Thank you so much.
You're welcome. Any
We,
other?
we do have your information up on the screen for those. I don't think that there were any more questions that came through. And I know Dashwell talked about locating support groups in your area can be very helpful. And I just noticed also it's important for us to communicate and open up about our own experiences and not be judgmental, because if we don't open up about our own experiences, then no one, our friend might be suffering in silence and we don't even know it. I've had friends that, after they got over their hump, they would say, oh my gosh, I was depressed for like a year. And I struggled as well after I had my child. And sometimes, especially when you have your child at an older age, you feel like I've waited so long. It was a struggle for me to have children. When I finally had children, I felt guilty about having those feelings, the baby blues, not realizing that it's normal for you to have those feelings. But we don't talk about it because you feel like, well, I'm supposed to be so happy and joyous because I finally, got my blessing. So I can't really say anything. But we have to talk about it and open up, because if we don't open up and talk about our own experiences and support each other, whether they had a child or they struggled and they weren't able to have children, then they'll never have that ability to go out and get professional support by mental health professionals like yourself. So it's important not to take that stigma away and just be open and supportive as a sisterhood.
Mm-hmm. Absolutely.
Do we have any other questions coming through? No. Well, I thank you so much for being with us, Natasha.
Thank you for having me. Thank you for having me.
It's always awesome to have a mental health professional with us, especially someone that is in private practice. Thank you very much. We honor you and we wish you much success in your business.
Thank you. Thank you again for having me, ladies. I appreciate it.
Let's give her a hand. Let's put our emojis in and thank her for her support. And before I close out for tonight, we would like to thank all of our community partners. As I said before, we've had some community partners that have been a part of the DREF team since last year. And these are they on your screen. If you are a part of any of these organizations, please make sure to represent in the chat. And of course, our featured community partners for tonight, the ladies of top, ladies of distinction. You all showed up and showed out. And also, I want to share with you that tonight's event, we had 189 registrants. So those 189 registrants will receive the education that we received on tonight via our newsletter. So you all have helped to educate multiples of 100 people, at least over 200 people that you all have helped to educate through this month-long series of women's wellness. Our next event is going to be on February 9th. We are moving into the month of February, heart health and wellness. And again, you will see Dr. Anderson as she facilitates a robust conversation with some local doctors and cardiologists in our community. Before I close out for tonight, please volunteers check to let me know if Reverend Dr. Dawson is on. I know that she is pulling triple duty on tonight.
She was on, Lakeisha. I'll have to double check, but I know she was on, and my dear and everybody else was on tonight.
Okay, she is pulling triple duty on tonight. There are 12 cities that are represented, and 3 of us had events tonight at the same time. And she is everywhere. I don't know how she does it, but she does it, and she does it with class and beauty. And I will be remiss if I did not say, please join this precision medicine movement. You can visit www.joinallofus.org/DRIFT to learn more about this program and enroll. The precision medicine movement is the quickest way for us to begin to reduce the health disparities that exist in the African American community. Again, I thank my team, this high-performing team, our community partners, and we look forward to seeing you on February 9th. Have a wonderful night.
Thank you and good night.